What's more worrisome, it's not so much that AI is being used to track and oppress people right now. What's more worrisome is that in the context of this pandemic, the groundwork is being laid for much more dark and oppressive potentials in the future, as well as for potentially more rapid and life-saving responses in the future.
Hello and welcome back to AIBC Summit YouTube channel. We're here to give you news on all things blockchain and AI. So if you are a fan of the space and you're looking to learn that a little bit more, be sure to give this video a big thumbs up. Now, a lot of the times when people refer to artificial intelligence, they ask the two questions: is AI safe, and is artificial intelligence a threat to the modern workforce? Sadly, if you turn on the news now, it's driven by COVID-19 talks, from stretched healthcare systems to the current pandemic mortality rate and also the economic impact. I'm joined by Dr. Ben Goertzel from SingularityNET to talk about if AI could have prevented and even predicted COVID-19.
Yeah, it's great to talk to you as well. I mean, these are strange times, but there's still a lot of amazing work going on in the AI and blockchain space, and some of it directly addressing this pandemic that's morphing all of our lives currently.
Exactly, and it's a really strange time, but I think it's so great to speak to people like yourselves, because as someone that's so heavily integrated in the AI space, when we look at this pandemic that we are seeing with COVID-19, are you observing this? Is this a situation where artificial intelligence at any point could have intervened and potentially mitigated some of the risks that we are seeing?
Well, there's a lot that could have been done to mitigate these risks in advance if resources had been focused on it. Absolutely. I mean, one point that strikes me every day when I look at the news is we don't have any sort of intelligent simulation modeling framework to understand the impact of various policies. So, I mean, we have huge policies like, let's shut down all the bars in this city, or let's put a 14-day quarantine on movement between this country and this country, or this state and this state. We have these huge rules being put into place that are impacting people's lives tremendously and costing the world economy trillions of dollars. Yet these decisions are being made based on either the gut feel of politicians or well-meaning, well-intended medical professionals, or else based on very, very simplistic epidemiological models that don't really take into account most of the particular characteristics of COVID-19 or of the social world today. It's possible to make much more powerful simulation models that are sort of like SimCity type models, where you're simulating. You have little AI agents simulating the different people in a city or a country and moving around doing things, and you use the simulated AI people in the simulation world to estimate what would be the impact of various policies. There are research papers on this. It's been experimented with to study, measles epidemics and some other cases of disease spread. But this is something where not too much focus was put on it because it wasn't a current concern, right? And I mean, we're a short-term driven global economy generally, where companies, which has been mostly who has driven AI development, I mean, companies will focus on what will increase their bottom line or their market share, or the number of eyeballs on their website. I mean, we don't have a mechanism to funnel resources into application of AI to things that won't make money or get any viewers in the short term, but obviously will be highly valuable in the medium term. And there's many other cases also. I mean, I've spent a lot of time applying AI to bioinformatics and AI to understanding, how the genome and proteome work and how the immune system works. And again, if you look at research papers on the prior SARS virus and the MERS virus, prior coronaviruses, with some similarity to the current COVID-19 virus. I mean, you find a lot of quite interesting papers, say, connecting how the immune system responds to these viruses with various aspects of the biology of aging and longevity. You see a lot of clues that would tell you, say, why COVID-19 affects the aged so severely compared to younger people. But again, this research wasn't really followed up on because I mean those viruses were squelched, and again, there's not much resources in the world for exploratory research of medical issues that are not causing an immediate problem. I mean, even though, of course, there are people out there saying, "Hey, we're going to have a big pandemic eventually." I mean, it's it's not the kind of thing we want to pay attention to. The whole issue of how traditional Chinese medicine and Western medicine intersect is also very interesting and relevant, and has gotten little attention. You look at the impact of COVID-19 on the elderly in Italy versus China, you see that for people infected with COVID-19 over the age of 80, I mean, in China, maybe 39% of those people will die. 80 plus year old COVID patients are infected. In Italy, it's in the high 80%. It's like almost 90% will die. Now, what's the difference there? Now, we don't know what the difference is. One factor that's interesting to me is in China, they're using a combination of traditional Chinese medicine and Western medicine. And one wonders if the use of the TCM, the traditional Chinese medicine, may be helping the elderly Chinese patients to survive the pneumonia better, right? But again, this is something where we've been trying to use AI to understand the complexity of how traditional Chinese medicine operates on the body together with Western medicine. But it's not what, say, the pharma industry has been focusing on. The pharma industry has been using a little AI, but it's more to figure out how to repurpose currently FDA approved drugs for other indications, right? Because that's the quickest way to use AI in the pharma industry to make money. So I mean, what we're seeing here is in a whole bunch of different cases, yes, there were things that could have been done to combat COVID-19, or to rather, there are things that could have been done to make it much easier to combat COVID-19 once it arose, so that it wouldn't spread so wildly and shut down so much of human society. But that's just not what our focus was on. And it'll be interesting to see what happens after this pandemic levels off. I mean, will society decide to put a little more energy into preparing for the next global crises, or will people completely forget about it, go back with great relief and enthusiasm to life as usual? Like, wow, I can go to the bar again, I can go party, go to conferences, visit my family again. Ooh, I'm really glad that's over. And then, 2 years later, some other strange thing, maybe a different sort of crisis happens, which we're also unprepared for. So I mean, the reality may be a mix of those two possibilities, or maybe a little bit more done to prepare. But I'll be pleasantly surprised if society does enough to prepare when the next global crisis comes around.
If we look at, for example, the fact that a lot of the conceptions for artificial intelligence is that it might dent the manual labour workforce, if we look at AI in perhaps testing, or for people that are on the front line, nurses and doctors that are, doing a lot of these testing and undergoing a lot of common workplace with individual people that may be infected or contagious, do you think it will change the public's perception of artificial intelligence, that actually, it can fill a void that a lot of people the public then have to do?
Well, a lot of people would rather have their groceries delivered by drones than by people right now. So, I mean, I think in some ancillary ways, people are happy now in terms of their practical lives under social isolation measures, that AI works even as well as it does right now. So yeah, people are happy with automated cash registers at the supermarket. They're happy with the drones if they can deliver things. There's a lot of conversations people are having with their Alexa and Google Home devices now that they're sending around the house. So I think in a temporary regime, when people are trying to avoid close physical contact with other people, obviously AI plays a special role, right? And so in some consumer applications, people are interacting more with automated systems than they would have before, and they're wishing they were smarter and smarter than they are now, right? Like now so many places you try to call for assistance with something, you wait on hold insane number of hours because everyone's waiting on hold at the same places. Let's say your airline flight was canceled due to travel restrictions and you want to get a refund or rebook. Often you're waiting on hold to talk to a human a very long time. If we had an AI that could handle more complex call center queries, no one would be waiting on hold to talk to a human. The AI would just be handling your problem, through the web or through the phone. So both the value of current AIs like delivery drones or Alexas is being seen very clearly now, and the value that would be delivered by slightly more intelligent AIs is being seen now in everyday life. So far, we haven't seen a huge impact of AI on the medical side of COVID, on simulating COVID spread or helping to create new therapies or new vaccines. I think AI has a huge amount of potential there, but the biology and medicine and epidemiology industry is not that savvy about AI overall. So when they need to respond very quickly to a crisis, AI isn't necessarily going to be what they first come up with. If they were using AI integrated throughout their operations, I think we wouldn't have seen nearly the amount of spread that we have so far, and quite possibly would be further along the discovery path toward that antiviral therapies that would greatly diminish the fatality rate. As far as the economic impact of this pandemic goes, I'm suspecting that it's going to have a number of indirect influences, some of which will be pertinent to AI, and will probably give AI sort of a kick forward. You've had a lot of service employees laid off around the world, given extended unpaid vacations in the last couple months, and I mean governments around the world are scrambling to help people through this difficult time with various stimulus packages. But I suspect that once the pandemic is done, only a certain percentage, much less than 100% of laid off service workers are going to be rehired into the positions they previously occupied. I mean, there's a lot of businesses that could be automating in various ways. Some ways that leverage AI, some ways that leverage simpler, computing or automation technologies. There's a lot of businesses that could be automating now and just haven't because of inertia, because they're going forward in a certain way with their human employees. It's working okay. Once the human employees aren't in the picture anymore, and they're being forced to rethink their business in various ways anyway due to the pandemic situation, it seems probable that afterwards, for a variety of reasons, we're going to see many of these service employees not getting hired back. And you can see many obvious examples of this. Like in the US, a lot of people are getting used to ordering their groceries online now. So, once you don't have to order your groceries online for safety reasons and you can comfortably go to the supermarket again. Many people will. On the other hand, many people now have, they've set up an account for ordering groceries online. They may have set up a recurring order for groceries they like, and they're going to end up going to the supermarket less often after the pandemic is done than they did beforehand. And I mean, this may be more efficient in terms of society overall. There's less people, polluting the atmosphere by driving their car to the supermarket, and there are fewer people spending their time going back and forth and walking down the supermarket aisle. On the other hand, you're going to need fewer people, working in the supermarket, physically restocking the shelves and sitting at the cash register and so forth. So overall, it would seem you're going to see a decrease in employment in service sector, and less of an impact in the knowledge sector, because most people doing knowledge work at their computers are able to work at home now and sort of keep going through the pandemic. At the same time, you're seeing consolidation in many industries. I mean, people are joking in the U.S. after this pandemic is done, the only retails left will be like Walmart, Costco, and Target and Amazon, right? I mean, that's an exaggeration, but it's a direction. A lot of retail establishments will go away, and it's a larger chains that have the cash stockpile wait out a pandemic, and that are operating more efficiently using automation technology. I mean, Amazon's warehouse is automated. The local corner stores shelves are not automated. So yeah, you're seeing greater unemployment in the service sector that will probably last, greater consolidation in various industries, along with greater concentration of wealth among the wealthiest people, which will continue beyond the pandemic also. And then all this disruption gives an opportunity for anything that's new and better to find a way in, right? So I think for both AI and blockchain technology, the disruption of various industries and of people's lives caused by the pandemic gives openness for AI and blockchain to come in and play a role in a variety of aspects where the industries were sort of ready for AI or blockchain to intervene and help them, but were just not proceeding in that direction because they were already doing okay as they were. Well, now almost no one is already doing okay as they were, so there's going to be more openness to new ways of doing things.
And you're right, a lot of people in the blockchain and tech space say that this is the time that developers can really work on their platforms and their models, and people have a chance to pause, and businesses, as you said, have a chance to automate as well. So this is a chance, like there's a catalyst right now. This is a time of change completely. Something that I did want to ask about, and we were seeing some slight news on this, is certain governments and their potential intervention when it comes to ensuring that the public are staying at home and making sure they're staying within their time constraints. Are we seeing that AI and certain technology is being used to ensure that the public are staying within their parameters of kind of government enforced lockups? Is the government actually using any forms of AI data to control in that regard? Is that something that you're aware of, or you think that we're seeing?
As far as I know right now, AI is not playing a huge or leading role in enforcing government movement restrictions like stay-at-home orders or social distancing. I mean, certainly advanced technology is, right? Like in Korea, everyone has an app on their phone. Actually, I have it on my phone. Last time I visited South Korea at the beginning of the pandemic, everyone in Korea gets an app on their phone, and you're supposed to put medical information into the app periodically, and of course it records the locations to which you've moved at various times, and the Korean government can then use that to track who someone diagnosed with COVID-19 may have intersected with and may have potentially infected. So I mean, that's use of mobile technology and apps and geolocation tracking and so forth. And that's been much more impactful than any use of AI so far, I would say. So certainly a lot of data is being gathered by various governments, and that data is being analyzed using machine learning and other AI tools, along with the statistical tools, based on the simplicity of the policies that governments are putting into place. I don't see any evidence, nor have I heard that AI is really being used to pull the strings of all the rules and regulations. I think if it were, we might see things being done more cleverly than what we see right now. But what's more worrisome, it's not so much that AI is being used to track and oppress people right now. What's more worrisome is that in the context of this pandemic, the groundwork is being laid for much more dark and oppressive potentials in the future, as well as for potentially more rapid and life-saving responses in the future. Because now many pipelines are being created, sucking in data about people's movements and people's physiologies, people's bodies. Many pipelines are being created to measure what people are doing and feed them into centralized databases controlled by big governments and big tech companies. And I mean, this is on the one hand, aggregating that data together for analysis by AIs and other methods. That's what we need to do in order to understand the pandemic better and in order to forestall further pandemics. On the other hand, it's obvious that with this, real-time panopticon monitoring where everyone is moving and what all their bodies are doing, right? I mean, it's obvious that governments and big companies working together could do some less broadly beneficial things with all this data later on. Because I mean, are the data pipes going to be turned off? Well, they're usually not, right? I mean, there's usually some reason to keep the data pipes turned on, either to ward off terrorism or because there's some other possible pandemic or to optimize this or that function, right? So there's a big worry that under the guise of preparedness for the next stages of the COVID pandemic and managing the current situation, the groundwork is being laid for much more invasive future actions by big tech and big government. And indeed, the blockchain world and the integration of blockchain and AI has the potential to solve this problem, because there are technologies that will let everyone upload their location data and their medical data. There are technologies that will let people upload this data in a way that lets the data be shared for common analysis, yet doesn't reveal whose data each particular data item in the central database is. So you can analyze the general movements of people and the general flow of an epidemic without storing in any centralized database people's private information. And this is possible using tools like multi-party computation and homomorphic encryption built on top of blockchains. Now, while that technology exists, none of it has yet been rolled out in a really scalable, easy to use manner, which is why these aren't being put out there as immediate, ready to use alternatives to the more centralized systems for data gathering and analytics that governments and big tech companies are using right now. And this is one of the things we're focusing on in an online hackathon that we've organized, we being SingularityNET together with Ocean Protocol and an industry group called the Decentralized AI Alliance. It groups together 50 plus organizations at the intersection of AI and blockchain. So we're doing a 2-month online hackathon called the COVID-athon, looking at pulling together people doing work at the intersection of AI and blockchain to help with the COVID-19 situation. And one of the many focuses there is creating tools that allow, sharing and tracking of data in a secure way that respects privacy and data sovereignty. Optimally, some of these apps will advance far and fast enough that they get adopted now, in the midst of this current pandemic. But even if that doesn't happen, if the tech takes a little longer, or if we're fortunate enough the pandemic clears up very rapidly, by the time some subsequent problem comes along, we want to be sure that these decentralized and privacy and data sovereignty respecting applications are out there and rolling and ready for prime time. Otherwise, what will happen is, each global crisis that occurs will bring us one step closer and closer to a regime where centralized, corporate/government databases track every single thing we do. And there's a lot of nasty things that could happen there. I don't see any evidence so far that in this pandemic, AI is playing a driving role in the monitoring and surveillance and tracking of people. I see the groundwork being laid. So in the next pandemic, AI will play that role unless decentralized technologies into the mix as soon as we can.
So I think you're right that actually ownership of your own data really is the most valuable asset that you can have. So regarding this COVID-athon, this hackathon that you're organising, if some of our viewers do want to get involved or hear a little bit more, where can they go to hear some more information?
Yeah, so there's a site called DevPost, DEVPOST, and DevPost is it's a fantastic website used to run all sorts of different online hackathons, and there are many hackathons within DevPost, but ours is the COVID-athon, COVID-athon, right? So if you search online for DevPost COVID-athon, you will get the page for our decentralized AI against COVID-19 hackathon. And yeah, we're recruiting software developers, AI researchers, people with biology and medicine background, but also, say, graphic artists to help with user interface design, so that there's opportunity for many different people from different walks of life to plunge in and help us see what we can do with AI and blockchain technology together to help combat COVID. And the various ideas I've talked about in this interview, the various directions for using AI and blockchain technology to help against COVID. These are all active projects within the COVID-athon with teams pursuing them, but there's also many other projects, some of which I don't even know about yet, which have bubbled up from the community. So yeah, we encourage you to take a look, see what's there, and then join in. There's the possibility to do things that will help right now, and there's also the possibility to lay the groundwork for technologies that will prevent things like this from happening again, and if they do happen again, make sure we can squelch them more quickly and handle them in a way that doesn't increase, centralization in government and business in the world at large.
Amazing. Well, thank you so much for sharing some of your insights. It was really fantastic to talk to you and get some clarity and also see how our viewers can get involved as well with the COVID-athon. So Dr. Ben Goertzel, thank you so much. And also we look forward to seeing you join our virtual summit in June as well. Thank you so much and take care.
Thanks a lot.
Thank you. That's all from myself and Ben. We'd love to hear how you found this segment. So share your thoughts with us.